Hi, I'm Jack, and today I'm in Camberwell to get an STI and HIV test. I haven't booked an appointment, so I'm just going to go in and see what happens. So now I'm logging in on one of the computers here, which is literally just as soon as you walk in. It's asking me if I have an appointment letter. No, I don't. My centre number, but I don't know what that is. So, yeah, your date of birth. Is that correct? Yeah. Your full postcode as well. That's fine. Now it's asking me if this is my first visit to the centre or if I've had one in the last 3 years. So I'm going to put first visit. Now you've got to put your full name in, so yeah. So it's not the most challenging thing I've ever done in the world. Just say your ethnic group, white British, and I am male. Right, now it asks me sort of how they can help me. I've got, I want a sexual health checkup. I have no symptoms. I have symptoms. I want a sexual health checkup. I want condoms. I've come for results. So I'm just going to put sexual health check, but with no symptoms. Okay. I said something 2 weeks ago, so I'm still on the test. Right, so now I wait for a ticket, and then there you go. So now I wait.
Okay. Jack? Yeah. Right, do you want to come through?
Yeah.
Have a seat. Right, hi. Hi, my name's Michael, Dr. Brody, and it's Jack, yeah?
Yes.
Okay, what can I do for you?
I'm here to just generally get a full sort of STI and HIV test.
Okay, sure. Is there any particular reason you wanted to do that, or is there anything that's worrying you particularly at the moment?
I had sort of a one-night stand 2 weeks ago. I didn't use any protection, and I just really want to know, just to make sure it's all alright.
Okay, sure. Have you had these kind of tests done before? Have you been checked up for infections in the past?
Yeah.
Well, when was the last time you had the test done?
Around a year ago.
Okay, and everything was fine then,
Yeah.
was it? Okay. Well, you probably know something about how things work, so I'll just run through what we're going to do, and then I need to ask you a few questions. I need to ask you a little bit of information about your recent sexual activity, and some background information about you. It won't take very long, and then I'll just run through with you how we do the tests. Okay, so when was the last time that you had sex?
2 weeks ago.
And was that with a regular sexual partner, or was that the one-night stand?
That was the one-night stand.
And that was without a condom, you say?
Yeah.
Sure. Was that a female or male partner?
Female.
Okay, and when was the last time you had sex before that with somebody other than her?
It would have been 3 weeks before that.
Okay, and that partner, is that a regular sexual partner, or was that a one-night stand?
It was, yes, it was.
And is that somebody you're still with now?
No.
How long was that a sexual relationship for?
Only around 2 weeks.
Okay, fine. And did you use condoms with her?
Yes, but then actually once, no.
Okay, fine. And going back to over the last 3 months, how many sexual partners have you had altogether? Just those two or any others?
One more, three.
Three altogether. And the other one with condoms or without?
With.
Okay, sure. And you haven't noticed any symptoms or anything that are worrying you?
No.
No stinging or burning when you pee, no discharge to the penis?
No.
Okay. Have you ever had these kind of tests done before, check up for sexually transmitted infections?
Yeah, once, a year ago, but didn't have the computers.
So you did that somewhere else, did you?
Yeah, I did that.
No, we've got the flash new touchscreen computers, haven't we? Do you have any medical problems or illnesses?
No.
Are you taking any medication regularly for anything?
No.
And are you allergic to anything you know about?
No.
And what time did you last pee? When did you last go to the toilet?
Around an hour ago.
Okay, that's fine. That's fine. I'll just run through with you how we do the tests. So we recommend testing for 4 main infections. That's chlamydia and gonorrhea, syphilis and HIV. And the way we do it is the chlamydia and gonorrhea test is done on a urine sample. So I just need you to go to the loo, do me a sample of urine, and we send that off to the lab. And then the HIV and syphilis test is done on a blood test. Is that okay?
Yep.
Fine. I've just got a few extra questions which are related specifically to the HIV test. The first thing is, have you ever injected yourself with drugs or shared needles?
No.
Have you ever had sex with a man?
No.
And have you ever had sex with anybody that comes from a part of the world where HIV is very common, predominantly Africa?
No.
No, fine. The reason that we run through those questions is it gives us a bit of an idea of somebody's risk factors for HIV. Those three groups, people who inject drugs, men who have sex with men, and people who have come from parts of the world where HIV is common, are the three main risk groups for HIV. The fact that you say no to answer to all of those questions means that we will put you in a very low risk category for HIV. We wouldn't expect you to have HIV, but we still recommend that everybody test, because you can never say never, and that anyone who's ever had sex has some degree of risk. But it sounds also like you're not really expecting the test to come back positive. There's nothing particularly that's worrying you about HIV. Is that right? Okay. A couple of other bits of information we give people around the test. One is just to stress the fact that it's completely confidential. In fact, all the tests we do here are completely confidential. So we give the information regarding the results to you, but then we don't give that to anybody else. So we don't write to your GP or anything like that. And the other thing that's important to understand about the HIV test is that there's what's called a 3-month window period, or a 3-month incubation period with an HIV test. Now what that means is that when somebody catches HIV, it can sometimes take up to 3 months before the test turns positive. For some people we can pick it up earlier, but we would recommend that whenever you have an HIV test, you repeat it again 3 months later for an absolute all clear. So what it means is that it's definitely worth doing the test for sexually transmitted infections, but because of the unprotected sex you had a couple of weeks ago, the HIV test that we do today won't cover that, so we'd recommend you come back in 3 months' time and repeat it.
Okay.
Is that all right?
Yeah.
For things like chlamydia and gonorrhea, they show up on the test within about a week. So those tests that we do today will cover the sex that you had a couple of weeks ago.
Brilliant.
All right? Have you got any other questions that you want to ask me?
No. No, I think it's
Fine. In that case, we'll crack on. What I'll get you to do first is I'll get you to do the urine sample. All right? So you need to go to the loo to do this. And what you need to do is do a sample of urine in here. You need to catch the first bit of urine that comes out, so you don't need to fill this up, just about half full is fine, and just pee the rest away into the toilet. Put the lid firmly back on again, and then bring it back to me in here, and we'll do the blood test then.
right.
Alright, there you
Okay.
go.
Thanks very much.
I'll just show you where the loo is. Great, come in. All done?
Yeah.
Right, so I'll just pop that down there, that's fine. We'll send that off in a minute. Have a seat, just get the door, and we'll do your blood test. Right, how are you with blood tests and needles? You don't,
Yeah, I'm all right.
you're not going to faint on me,
Don't really enjoy it, but
Fair enough. Okay, what you need to do is roll your sleeve up just above your elbow. That side's probably easier because you're a bit nearer. Perfect. I'm just going to put this on. Can you just maybe come around the side a bit more, so a bit closer?
yeah.
Okay, that's it. Can you just press on that for me? Press hard. Okay, so that's all of your tests done. We'll send those samples off to the lab now. It'll take us about 10 days or so to be able to get the results to you. And you have a number of choices about how you get your results. We can text you with them, we can write to you with them, or we can give you an appointment to come back and pick them up. Okay. Which of those would you prefer?
Can I text, please?
Yeah, absolutely. I'll just check we've got the right, you've got your mobile number. Yeah, good. Okay, well that's everything, unless you've got any other questions for me now.
No, that's me all done.
Okay, great. Well, you can get off and you'll get a text from us in about 10 days' time with the results of those tests.
Brilliant.
All right.
Thanks very much.
You're very welcome. Cheerio then.
So, just had the test, and it was really easy, and it wasn't embarrassing at all. And literally, I came in this morning and I was in and out within an hour. So now it's going to wait 10 days for the text.